They are among our most vulnerable, children suffering with crippling mental illness. In a crisis, their families turn to hospital emergency rooms for help. But finding mental health care doesn't come quickly. Tonight, Fox 47's national investigative correspondent Ross Jones shows us how kids across the nation are in a mental health crisis, but many hospitals are out of room.
I'll never forget it. We were there, it was like 8 days. And finally, they found a bed.
The hospital bed Erica Sorrow needed was for her young son, Jonathan, who she rushed to the emergency room after he heard voices telling him to cut his wrists.
So he sat for 8 days
In the emergency room, on a gurney.
What happened to Jonathan is called boarding, when psychiatric patients in crisis are forced to wait because there isn't the room or staff to admit them. Instead, they languish in emergency departments for hours, days, sometimes even weeks, knowing that if they leave, the wait starts all over again.
It is day 8 of Ellis's hospitalization. If I take him out, I will lose our place in line. Places are so limited for a 5-year-old.
She was hurting her brothers. One day she ran for the scissors as she was saying she's going to cut her wrists.
The Goodbands took their daughter to 2 different hospitals. Both had no room. We found them waiting in the ER at UNC Hospital in Chapel Hill.
For 37 days, you've been looking for a bed for your daughter.
Yes.
And you're still looking.
Yes.
I'm pissed.
Every day, Dr. Jane Bryce is on the front lines of a losing battle.
That's just not right. That's inhumane. It's unsafe. They're not getting the care they need, and it makes me angry.
A Scripps News investigation reveals that children all across the country are falling victim to an overtaxed system. Nationwide, we surveyed hundreds of hospitals and mental health facilities. Of those that responded, 88% reported referring children to other facilities in 2015 because they couldn't treat them. But the numbers only tell part of the story.
Honey, I just want the doctors to see how sick you are.
This cell phone video, captured by a mother in the Midwest, was shot when her 12-year-old son was boarding at home after a hospital told her it would be days, maybe weeks, before there'd be room.
Hey, buddy, can we just please work through this?
No, I already did! Stop recording me!
Okay, I love you.
Nationwide, the number of state mental health beds continues to plummet. There were more than 330,000 public beds in 1970, but by 2010, fewer than 50,000 remained. And according to a more recent survey, 33 states saw even more reductions in bed counts between 2010 and 2014. Angela Kimball is the Director of Public Policy for the National Alliance on Mental Illness.
We don't have the intensive outpatient children's mental health services that would help avoid the need for emergency room visits.
And making the boarding problem even worse, she says, is a national shortage of child and adolescent psychiatrists, leading some to wait months just for an appointment.
If we didn't have that kind of treatment that's needed for cancer, we would be astonished and we would be appalled. Not so for mental health.
Here in Washington, there's one piece of legislation that could lead to some help. Congressman Tim Murphy's bill aims to add more psychiatric beds and child psychiatrists. It passed the House in July, but today it's stuck in the Senate. For Scripps News, I'm Ross Jones.
So is there a solution? Well, a hospital in Rhode Island has found a way to reduce its wait times by half, and the numbers are still dropping. For that story and so much more, including finding out how many psychiatrists are available by county, log on to our website at fox47.com and search for In Crisis Out of Room.